If you have type 2 diabetes, the shoes on your feet right now could be one of the most important health decisions you make today. Poor circulation and nerve damage from diabetes mean a simple blister or pressure point that most people wouldn't even notice can turn into a serious wound. And for diabetic seniors, that can escalate quickly into infections, ulcers, and complications that are completely preventable. Today I'm going to show you exactly what to look for in a walking shoe when you have diabetes, and the 4 features most seniors don't know to check. Welcome back to Strong After 60. This week I'm covering a topic that has a direct impact on your safety and independence, and most people only learn about it after something has already gone wrong. Let's make sure that's not you. Here's why this matters so much specifically for diabetes. Diabetes causes 2 problems in your feet that don't happen in healthy feet. First, nerve damage, called neuropathy, means you may not feel pain, pressure, or injury the way you should. A shoe rubbing a blister might go completely unnoticed for hours. Second, reduced circulation means your body is slower to heal any wound that does occur. These 2 things together make the wrong shoe genuinely dangerous. Research shows up to 50% of diabetes patients develop some degree of neuropathy. The right shoe is not a luxury for this group, it's a medical necessity. Feature 1, and this is non-negotiable, a wide toe box. Your toes need room to spread naturally when you walk. A narrow toe box squeezes your toes together, creating pressure points and friction that lead to blisters, calluses, and corns. For diabetic feet, those injuries are high risk. Look for shoes labeled wide or extra wide. When you try shoes on, you should be able to wiggle all your toes freely. There should be roughly ½ an inch between your longest toe and the end of the shoe. Always try shoes on in the afternoon when your feet are at their largest. Diabetic feet often swell throughout the day. Feature 2, a seamless interior. Traditional shoes have internal seams and stitching that rub against your skin with every step. For most people, that's a minor annoyance. For a diabetic senior with neuropathy, it's a wound waiting to happen that you might not even feel developing. Look for shoes specifically labeled seamless interior or seamless lining. Run your hand inside the shoe before buying. It should feel completely smooth. Brands like Orthofeet and Dr. Comfort build this into all their diabetic lines as a standard feature. Feature 3. Genuine cushioning. This isn't about comfort alone. For diabetic seniors, thick cushioning distributes pressure evenly across the bottom of your foot, preventing the concentrated pressure points that cause ulcers. Look for a thick midsole, at least half an inch of cushioning material. The Hoka Clifton is one of the most recommended options in this category. It carries the American Podiatric Medical Association seal of acceptance and is known for its thick, lightweight foam. When you press your thumb into the sole of a good diabetic shoe, it should compress noticeably. If it feels hard, put it back. Feature 4. Adjustable closure. Diabetic feet often swell throughout the day, sometimes significantly. A shoe that fits perfectly in the morning may feel tight and restrictive by afternoon. Look for shoes with Velcro straps, wide laces, or adjustable closures that let you customize fit as your feet change throughout the day. Velcro closures are also much easier to manage for anyone with arthritis or limited hand mobility, which is extremely common in this group. Here are 4 brands that podiatrists and diabetes specialists consistently recommend. Orthofeet, wide range, APMA seal of acceptance, excellent for bunions and wide feet. Dr. Comfort, specifically engineered for diabetic foot complications, strong cushioning, Velcro options available. Hoka Clifton, the best cushioning in the group, excellent for seniors who walk regularly, carries APMA approval. New Balance 928. Leather upper, superb motion control. Excellent for seniors with stability concerns. All 4 are available on Amazon with links in the description below. And importantly, Medicare Part B may cover up to 80% of the cost of therapeutic diabetic shoes after your deductible. Ask your podiatrist about this at your next appointment. Quickly, what to avoid. Flip-flops and sandals that don't secure your heel, thin-soled flat shoes with no cushioning, narrow fashion sneakers that squeeze your toes, and any shoe that requires a long break-in period. A diabetic shoe should feel comfortable the first time you put it on. If it needs breaking in, that breaking in is happening on your feet, and that's not acceptable. The links to all 4 recommended brands are in the description below, along with information on Medicare coverage for diabetic shoes. Your feet are the foundation of your independence. Protecting them is one of the most important things you can do when you have diabetes. If this video helped you, please share it with someone you know who's managing diabetes. This is the kind of information that can prevent a serious health event. Subscribe for a new video every week. I'll see you next time.